Hi, I'm your host, Marsha Florence with Just Dance Podcast Live. Thank you, ladies and gentlemen, for tuning in. For everybody's working from home, and so are we, but we want to continue to bring you the programs that you're used to seeing in your home on Facebook now. So you can also go back to channel 56 if you miss it on Facebook, or check your cable listing for the current shows. So today's show, ladies and gentlemen, is Detroit Recovery Project, and we have with us the Vice President himself, Kanzoni, Dr. Kanzoni Ashabiji. Good afternoon, Dr. Ashabiji.
Good afternoon, Ms. Florence, and thank you for inviting me to your show.
Thank you. Now, Dr. Ashabiji, I know you're at the office. I can see everything that you're working very hard over there at Detroit Recovery Project. And I know that we normally see we're going to be seeing Dr. Andre Johnson in the future. So please tell him thank you so much for having you fill us in on what's going on with Detroit Recovery Project.
Thank you very much. I'll let him know that, and okay. You extend, greetings to him. Yeah, so at the Detroit Recovery Project, a little background about myself. I worked for the Detroit Health Department for about 17 years. IV and other programs, but prior to retiring, I became the Senior Public Health Advisor, advising on multiple topics, including communicable disease, and then for COVID before retiring. And after I retired, I joined Detroit Recovery Project in June of this year. And Detroit Recovery Project is a really dynamic institution, well known in the community, providing substance use disorder services. And we've now added a new program that I'll talk later about, a certified community behavioral health clinic, providing mental health and primary care services also.
Okay. All right. Well, wonderful. Now, you know what? I'm going to say this, Dr. Aviji. A lot of organizations are not, I'm not going to say not, we haven't heard from some to find out what are they doing at this time with the COVID-19 crisis in place. So can you tell us about what's going on with Detroit Recovery? How are you guys working with the public, and what steps have you taken to continue to keep your doors open?
Okay, thank you for that question. Here at the Detroit Recovery Project, we continue to provide services to the community, but we have scaled down the face-to-face encounters. So what we've done is to make sure that we protect our employees and also protect the people that come in to provide, to seek services. So we've implemented a process whereby people, when they come in, they will get their temperature checked. We also ask, about COVID symptoms, just to make sure that they're not symptomatic or they haven't been exposed to somebody who had COVID. And then we also require that they wear a mask. Wearing a mask really helps to prevent the transmission of COVID. Then we also have them come in and then fill out a questionnaire. And when they receive those services, we make sure that we have social distancing and we limit the number of people that, in a room that can accommodate with all the social distancing. In that way, we are able to provide and continue to provide services to the people who need those services. And in addition to that, we also provide telehealth, whereby people, we can reach them on the phone or via video on FaceTime or on Facebook and other smartphone devices, that we can continue to reach out to them and provide them with counseling and other resources that they may need.
Now, what's your response level to the people who are using telehealth? Some people aren't comfortable with speaking or talking about their situations by phone, but how is that working out for Detroit Recovery?
Well, thank you. That's a really good question. It's new. Some people don't are not comfortable
Hmm.
because it's not direct face to face. But when they get used to it, they like it, especially when they see the counselor that they know. So they're more comfortable that way. One of the barriers that we've encountered is that in our community, we don't have a lot of people who have those devices, or they don't have, internet service or broadband. And so it becomes difficult for them to connect that way. So those are some of the barriers that we've noticed already. So we try to, reach them on the phone and try to make sure that they continue to receive those services. And if they can come in, we work with them to make appointments for them to be able to come in.
Okay, okay, because you guys do a lot of events throughout the year, especially community service events to, bring people together, educate and provide resources. Now, I know you had to make some changes within that region. So, do you have anything that people can actually somewhat not necessarily gather together, but did you guys have to cut back on some of your events for the year?
We did cut back on the events for the year, like prayer breakfasts
Hmm.
that we used to host and have other events, going on. But on the other hand, we also do that via Zoom or Google Meet, so people are able to access the same services, just not face to face, but they're able to receive the same services and connected to resources. So this is recovery month. September is recovery month. We
Yeah.
always have, events going on. We still have events going on. We had a town hall meeting the other day, and people were, online talking about some of their experiences and about COVID and just being isolated. One of the things that continues to come up with the pandemic is that people are isolated, and that exacerbate their mental health disorders if they have, or it just makes for people to be too lonely for
Right.
a long period of time.
A lot of people, even though they may be homebound, some people can reach out and talk to people, like you said, by Zoom. Some people can do duo over the phone or just stand in the yard and talk. But a lot of people seem to be, and I don't know if it's being introvert or whatever, but it's something about they're not really connecting with other people nowadays. I know the level of fear that we have, but far as like if you go to the store, boom, that's all I want to do is go to the store. If I had to pay a bill, I do it, electronically and pay a bill. So we really don't have a lot of communication across the board like we used to when you had to go and pay the bill or you had to go see the doctor. So
Yes.
yeah, it's
So
affecting everyone.
yes, that's correct, Ms. Florence. So what we do is we also have recovery support specialists and coaches. We encourage them to call our clients if they haven't heard from them in a long time,
Okay.
just to find out how they're doing. How are you doing, John or Mary? How are you doing? Anything that we can help you with. And we also encourage, those who receive services and our community members to reach out to family and friends. Just sitting alone in your home or house or your apartment it's not good for you,
Good.
for a long period of time.
Right.
As human beings, we need to interact. We talk to each other. We interact differently, but the interaction helps us to, survive, and it helps our emotion.
Right.
Seeing somebody face to face and just touching somebody means a lot to us as human beings.
It does.
So this period is really difficult, but at the same time, we have to do this in order to survive. And
Mhm.
so, especially for African Americans, we really have to take this virus very seriously because it affects us disproportionately. It Because a lot of us don't have insurance or are underinsured, have difficulty with transportation, getting to the doctor's office. And so when we do get it with pre-existing conditions, it just makes our cases worse. And the statistics bear that out. So
I'm
my
sorry.
advice, go
I'm
ahead.
sorry. You know, we have a list of the services you guys provide. So I wanted to go over that list, and we just brought that list up. Can you tell us about some of those things on the list?
Yes. So we provide, recovery support services. Again, this is where we have the coaches and the specialists, reaching out to people in recovery and other community members. We also just received a grant from the federal government to provide mental health and primary care. So now we will provide mental health services and primary care services. So we have a nurse practitioner and a physician who can provide these services. We know that people in the community and people in recovery have a difficult time sometimes getting to the doctor. So when they come to DRP, they can get substance use disorder services, they can get mental health services, and they can get primary care services. We've also arranged for them to get, fill their prescriptions. The pharmacy can deliver the prescriptions here so they can get a holistic service
That's great.
instead of going from one place to another, to get those services. And we know them, so they can relate, and we can relate to them and provide them the needed service that they need.
That's great. Well, that list was powerful. So, with all those services listed there, if someone is going through a period of depression or suicide, things like that, you guys are there for them. And now, what's a phone number, or is it an email or something? How can people get in contact?
Yeah, people can get in contact with Detroit Recovery Project by calling, 313 365 3100.
Okay.
Again, that number is 313-365-3100. We have two locations, and one on the east side on McNichols, East McNichols and 75, and then the other one on the west side on West Grand Boulevard, just off um, uh, West Michigan Avenue. If you call that number, we'll make sure that you get to the right location that's nearest you to be able to receive those services.
Okay. Now, I need to touch on the new program. I don't know if it's new, but the Certified Community Behavioral Health Clinic and the initial CCBHC. Okay. So, is that a new program that you guys have, or is that something that's already been in existence and we're just not getting to it?
Oh, yes. Thank you very much for that question. This is a new program that we received a grant from the federal government. And we received it back in May of this year. And we just started operations. So it's certified community. The word community is very important. Behavioral health clinic. So it's structured just similar to what we call federally qualified health centers. Maybe there are some here that already people are aware of. They abbreviated FQHC, that people can receive physical health services. So this CCBHC is for mental health services. So the federal government saw the need for individuals, vulnerable populations, people who are indigent, people who don't have insurance, people returning, returning citizens from the prisons, or community members, that experience poverty can access these services within their community without paying. So we can provide now mental health services, outpatient mental health services, and we can provide primary care services. So we don't provide specialty care, but our doctor can admit a patient at any DMC hospital, whether it's receiving, Sinai, but we can manage, chronic diseases. We know that a lot of community members, some of them suffer from diabetes, asthma, high blood pressure, or other chronic disorders like emphysema or COPD. They can come here and get those services. We can also provide flu shots. So we're now, going to provide flu shots beginning Monday. We just ordered those, and we're doing that. The other thing to note also is that from time to time, we collaborate with Wayne State University and the health department to provide COVID testing. So last Friday, September 18th, in our location here on the west side, in the parking lot, we had community members and other people who wanted to be tested for COVID come in and get those tested, for free. So this is something that we want to do and continue to do, and also to provide resources to make sure that people understand, what's bothering them under these conditions, what the COVID virus is, and how to protect themselves and also others, and make sure that we don't get sick, or if we get sick, we seek immediate care early. Very important, early, not wait until it's really bad.
Now, with the program in place, the CCBHC clinic in place, uh, does the operation Monday through Friday or 6 days a week? How many days a week is the operation for the clinic?
Yes, it's 6 days um, a week. So it's Monday through Friday, 9 to 5. And then Tuesdays and Wednesdays, we even have extended hours because some people can, have to come in after work until 8 or sometimes 9 p.m. if we need to open up. And then we also have uh, hours for Saturdays from 9 to 2 p.m. So we're open, and this new program also allows us to provide services 24/7. So when people call our number, in the night, it goes to somebody who is on call. And so, if they're experiencing suicide ideation or contemplating suicide, they can call. So if we can help them and also direct them to the suicide crisis line, or get them other resources whereby they can receive services.
Okay, that's wonderful. Because a lot of times when you say clinic, people are like, well, I got to work, or, how can I get there if I don't get off work till after 5 and this and that. So those extended hours on those 2 days during the week and Saturday is a plus for the community. Now, let me ask you this. So this program here, this clinic here, is it for adults, or is it for adults and children, or entire family?
It's for adults at this time. So we see adults and adolescents from age 13 upward.
Okay.
So we do provide those services. Until we get a pediatrician, it does allow us to provide services to, children. But until we get a pediatrician, we're waiting to just make sure that, we uh, get everything in order.
Well,
Just,
you're covering the main bases, which is the parents, okay, and you're saying young adults, so preteens and things like that. Because even with young people, such as the age of 13, 14, they're getting depressed for being at home, unable to communicate with their friends outside of the phone system. No sports right now, or limited sports. things of that nature. So it makes sense to have programs in place that they can at least talk out their situation or get their health checked out to make sure that they're on point.
Yes, absolutely. And to add to that, we also have prevention programs, for substance use disorder and mental health. So teens can also call, and we have programs to help them cope. Talk to their peers, and just make sure that they have the necessary information to be able to cope in any different situations, and also just make sure that they are open and have discussions with relatives or adults that can help guide them in the right way, and just make sure that I have kids, and most of the time they are home, they're going to school online, and I just see them in the house. So I said, well, let's go and walk around the neighborhood, ride your bikes, and we sit down and talk, because they're always in their rooms, just in class,
Now,
or watching TV or playing games.
right, but a lot of people may not realize that part of the situation dealing with COVID really brings families closer together. Like you said, families can eat dinner together now, sit and talk with one another. How you feeling? What's going on with you? Play games, uh, you
Absolutely.
know, do housework together. Some things that a lot of young people have escaped from because of the way technology is now. So I'm sure you and I probably come from the same, age group where you had chores and you had to do things before you could go outside, and your homework was checked, and you ate at the table with mom and dad. This generation here, it's like text and say, is dinner ready? Okay, so but with the COVID in place as it is, it seems as though it's allowing families to come closer to understanding how to protect one another and support one another during this time.
Yes, absolutely. You're right. Just talking, helps people to just cope and also understand how each family members feel about the situation. So like you said, my kids, sometimes I'll sit next to them and they're texting me. I'm like, I'm just right here. Talk to me. Put the phone down. Talk to me. Why are you texting me?
You have to take
Because
the
they
phone away.
do that with their
Right,
friends.
right.
And
Get
their siblings. They're just sitting right next to each other, and they're texting each other and laughing. And I'm like, okay, talk to me.
right, right. I mean, nowadays, if you're going to put a kid on punishment, you have to take the phone away, and that's the punishment. Other than that, there is no punishment. Okay. So, yeah, they have to, you have to have family unity time away from technology to understand what's going on in the minds of the adults as well as the children and the grandparents.
Absolutely, absolutely. Where possible, go out, go some and walk, go as a unit in the family. Social distance from other families or other people that you don't know or haven't been in touch for a long time.
Mhm.
Socialize that way. You just can't be in your house all by yourself, but make sure that you follow the guidelines, that you wear a mask is very important. You wear a mask, not wearing a mask to cover only your chin, but to cover your mouth and your nose.
Right.
So wearing a mask is not a fashion statement. It's meant to protect you and
The health
protect
state.
your loved ones and other people. So I see people, they wear a mask and it's just up here or down here. Well, that doesn't, no, it's just
Defeat the
equivalent
purpose.
to not wearing a mask, because the virus hangs in the air. So if you don't cover your nose, you're breathing it in, and that can cause problems.
Right. Well, I tell you, I know the Detroit Recovery Project is on its mark with making the community a much safer place, and I'm sure the residents in the surrounding areas appreciate Detroit Recovery Project and all the programs and services you guys provide, because really you guys have been around for quite a bit of time here, but the enhancement of your services are greatly needed. And I'm sure that the Certified Community Behavioral Health Clinic will be one of those that people will always, come to get some type of services for their family members and themselves. That's a great service there.
Thank you very much. Yes, that's a great service to the community. And just last week, our entire team here at the Detroit Recovery Project, we did some exercise also, just walk in the neighborhoods and drop off leaflets, just letting them know we now provide primary care. So if you're in the neighborhood, they should know what you're doing. And then be a partner to improve the health status of the neighborhoods. Make sure that they are invited to events. So we had a really good reception from the neighbors. They were really pleased to see us come in around and drop leaflets and provide information about what we were doing. And some of them showed up last Friday to get tested for COVID, and that was really nice.
Okay, okay. Well, that goes to show you, Dr. Biji, things do take time, but when they're in place, people come out and take advantage of what they can to make sure they're doing okay. Just know that you guys are testing people is a plus, so that people can say, "At least I've been tested, I've gotten through this period," and now can they come back and be tested again after they've been tested once or twice or whatever?
Yes, they can come back and be tested if they want to. The science, put my public health hat, people can get it if they got it one time. So, especially if they've been exposed, again, after being tested and they've been exposed or they experience any symptoms of COVID, yes, they need to come and get tested. And the symptoms are, high fever, usually one that is, 101 and above, coughing, not just our regular cough here and there or sneezing, but just coughing, that's we cough. You produce a lot of if you're infected or have the virus, you produce a lot of it, and it's aerosol, it's airborne,
Right.
sneezing or muscle pain, things like that. Anytime that you just don't feel right,
Okay.
call your doctor,
Right.
and just let them know, I just don't feel right. It may or may not be COVID, but if you just don't feel right, something is not right. So
Check.
you need to call your doctor right away.
Okay, check me out. Well, Dr. Avicii, I appreciate you coming into us today at the Just Dance Talk Show podcast live. We really appreciate having you. And please do tell Dr. Andre Johnson we said thank you once again for having you in his place. Okay. And we look forward to seeing you guys again and hearing more about Detroit Recovery Project's future endeavors, because you guys always got something going on. Okay. So will you come back and join us again?
Absolutely. And thank you very much for having me. Thank
All
you very much.
right. Well, ladies and gentlemen, you know who I am. I'm your host, Marsha Florence for Just As. And you know what I always say, if you know a person with a disability or if you just have a general question, don't be afraid to ask, just ask. But always remember, you can call us 1-800-323-5336. Email us at justastalkshow.org or Marsha at justastalkshow.org and give us a show idea. And we'll have you in the cool seat of the Just As Talk Show. So once again, thank you. I'm your host, and thank you, Dr. Avicii. Have a great day.
Thank you. You too.
See you next time.